I mentioned, is on the agenda. My name is Kim Whitley, and I'm the Chief Operating Officer for the IHN CCO. I also serve as the Chair of the Delivery Systems Transformation Committee. I have to recognize Sherilyn Dahl because she also shares that position with me so that we always have coverage. The Delivery Systems Transformation Committee has been meeting every 2 weeks since the beginning of the IHN CCO. So it's a dedicated committee. The committee is made up of providers who have the ability to affect the health outcomes of our members. In fact, we start every meeting by saying that this meeting is open to any individual in Lynn, Benton, or Lincoln counties who has the ability to improve the health outcomes of members. The Delivery Systems Transformation Committee originated was in the CCOs. This contract requirement requires that every CCO have a transformation plan. The transformation plan has to have 8 elements. The first element is to integrate physical, mental, and dental health, so we have to have a plan on how we're going to do that. We have to develop and ensure our members are assigned to primary care homes. We have to develop and facilitate and implement alternative payment methodologies. We have to recognize the community health improvement plan and make efforts to align our transformation with what it says. We have to facilitate the usage of electronic health records, ensure that our health communications are culturally appropriate and health literate. We have to ensure the diverse needs of our members are met. And we have to have quality improvement plans that focus on eliminating disparities. So when we looked at this, this is huge, and we had to develop ways of making these things happen in the communities of Lynn, Benton, Lincoln counties. And so when we first came together, we decided to do this through pilots. We thought Lynn, Benton, Lincoln counties is pretty big, geographical spread. We have a diverse population with unique needs in every single county, and we needed to recognize that. And so we didn't want to come out and we presume that we knew the answers. We felt that those answers were best coming from the providers and working with feedback from the members on what would work in each area. And so over the last 3 years, the IHN CCO has worked as the backbone organization to facilitate new and interesting ideas in the form of pilots throughout the CCO. So the IHN CCO guides the vision and the strategy of transformation. We don't create it. It's not ours as an IHN CCO, it's ours as a community. And we guide that vision and strategy, and we help take it forward. We support aligned activities across all 3 counties. Our goal as a CCO is that every single member can expect the same quality and standard of care no matter what provider they go to in the counties of Lynn, Benton, and Lincoln. We've established a shared measurement so that we know when we're getting there and how far we have to go. We build public will. We're advancing policy to ensure that the inroads we're making are sustainable, and we're mobilizing funding. And that funding is what we use to support the pilots. Now you have a couple of handouts on your tables. The first one is called How We Find New Ways to Deliver Care and Improve Health. This is an illustration of what the Delivery Systems Transformation Committee is doing. So as I said, the Delivery Systems Transformation Committee is open to any provider who can improve the health outcomes of our members. They are supported by a team of health plan employees who together facilitate grants. We apply to them, and we've been awarded quite a few. We facilitate pilots and then work groups to really support those 8 elements of transformation I mentioned. Another handout that you have goes into this a little further. It's this one. It's white. We have some of our pilots on the left. It's not a complete list. Our work groups that support the 8 elements of transformation are in the middle. If any of you would like to belong to one of those work groups, let us know. They're open to the public. And then the grants that we're currently managing. The pilots have gotten very numerous, and so we have another sheet where we've kind of spelled them out a little further. Or are yours is two-sided? Somebody's saving paper? Go! So that's great. One of the things that we've been working on over the last 3 years is really organizing the structure of how the delivery systems transformation team functions so that we can make sure we're achieving our goals. And so I wanted to be clear that as the Delivery Systems Transformation Committee reviews pilot ideas, I wanted to be clear with you all how we make decisions on what we fund and what we don't. So we have 3 top priorities when looking at a pilot. Does it meet one of the elements of transformation? Does it meet one of those 8 elements of transformation? Does it or can it improve a community health improvement plan focus area? So can it improve access to health care? Can it improve behavioral health, chronic disease management and prevention, and maternal and child health? And finally, can it improve one of the metrics for which the state of Oregon measures the progress of the CCO? So that's how we've looked at pilots over the last 3 years. As of today, every part of our process that's been evolving is every January and February, we take the time to review our processes and improve. And so that's what we've been doing. We've had Bill Buska is here, Innovator Agent, has helped facilitate some technical assistance for the Delivery Systems Transformation Committee to review how we look at pilots and come up with our focus for 2016. And so right now we're in the middle of that strategic planning process. And I just wanted to also call out on that Frank Moore, who's also here, has taken a role in helping put together information related to how the CHIP interacts with the Community Health Improvement Plan, interacts with the transformation goals, and other things that are going on within the CCO to make sure that we truly are aligning our efforts and focusing on pilots that will get us where we need to go to improve the triple aim and the health of our members. So with that, I wanted to have you all see a video on one of our pilots. My driver, I lost my driver, she's back.
My name is Janice Swoboda, and I'm a licensed clinical social worker, and I'm here working for Samaritan on a grant from the IHN. And the IHN, as you know, has an aim to help make healthcare more affordable, more efficient, and more accessible. In the history of medicine, especially in the last, it seems to me, 20, 30 years, there's been a real split about what is medicine covering. And so we get this idea that there is medical health and then there's mental health. And part of my hope was to reduce that schism, to say that, look, your body and your brain are born in the same container. Your heart, your soul, your brain, your lungs, your feet, your emotions, all contained in this one bag we call our body. And if you try to pretend that what is happening in one part of that set is not affecting the rest of the set, you get in a lot of trouble. So what I found is that about 70 to 80% of the time people go to the medical doctor, what they're really talking about is something that's not working well in their life and it's showing up in their body. And some people think that sounds like voodoo, but this is just science. When you are stressed out, when you're under a lot of pressure, your body is secreting these hormones that are designed to get it out of troublesome situations. So your body gets flooded with adrenaline, and you're supposed to use that adrenaline to fight and flight. Your pupils dilate, and you start taking in all the information, and you start sweating, and all these have really good purposes if you're getting eaten by a bear. And they don't work out so well when the major problems that you're solving are things like paperwork, deadlines, and trying to figure out Epic, or trying to figure out how to sign up for insurance. You know, all these kind of modern daily problems that we have where you can't beat anybody up and you can't run away. So what I try to do is teach patients in the doctor's office how these stresses are affecting their body and then teach them ways to decrease the stresses. I try to demystify the idea that when the doctor says to you, this is stress related, he is not or she is not saying to you, you made this up, or it doesn't matter, or it's not really hurting, or something's not wrong with your body. But what they're saying is what's wrong with your body is not something that we can cure by giving you a pill, or it's not something we can say, oh, your disease is X, and it was caused by this germ. Because a lot of our dis-ease is caused by the germ of life. It's just the regular kind of problems that we run into every day. And we don't use our bodies during the day to work off all those chemicals like we would have in the old days. So even when we can't fight or flight, we still would have worked the chemicals off just in daily life. Now we sit around at our desks and work on Epic or whatever it is we do, and our bodies don't move and essentially think we're trapped. So the circulating stuff results in inflammation, which results in inflammatory disease, like heart disease, like asthma, like diabetes, which is an autoimmune disease. We've seen a big surge in these kind of things. So sometimes the doctor will say, you should go get counseling. And guess what? People don't do it. The main reason people don't go is because there's a stigma about mental health. The idea that mental health problems are a result of a character defect, a lack of discipline, some kind of moral problem, as opposed to just like our physical health, some of us have stronger components in some parts of our bodies and some parts of our coping skills and less in others. So I like to be right there in the office when somebody's talking to their doctor and saying things like, I don't know what's wrong with my hormones, but I want to kill my husband. Or they say, I'm so stressed out from my job that I can't sleep anymore at night. And the doctor says, well, here's why I don't want to give you a pill for that, a sleeping pill, because it may help tonight, but we can't give it to you forever, and then what do? And then the person goes, great, I just don't sleep. So instead of that being the end of the session, I come in and I say, let's talk about what we can do to help you with your sleep. Let's talk about what's not working in your life, what we can change, what we can do differently. I work on how are you going to have a sense of purpose in your life, to feel like there's some reason you're here and that you're enduring this suffering. I work on trying to help them increase their natural resources. Having mental health services available in the doc's office where people show up anyway once a year is cost effective, because if people can get their help there through me in a session or two, that's a lot cheaper than a visit to an ED. It's a lot cheaper than a hospital visit because they haven't been able to manage a chronic health condition. It is convenient. It's low stigma and low barrier. People are much more likely to come back to somebody they've actually met than to go meet somebody they've never seen before and tell them their life story. So I'm encouraging Samaritan to look at social workers more as a clinical resource for the clinics, a low-cost one. People returning back to school, people being able to form intimate relationships, people finding meaning and joy, people adding to volunteer services. I've had people get off opiates after 7 and 8 years, get off disability and go back to work. You can't measure that stuff with a PHQ-9. I mean, I can show you that it got better, but that doesn't really tell the whole story. So I find this work incredibly fulfilling. There's nothing better than the honor of sitting down and hearing somebody else's story and then looking at what strengths are already in that story and helping them use those to have a healthier and happier life. And I thank the IHN for the opportunity to do this for 1.5 years. It's been a lot of fun.
So that was just an example of one of the pilots. So one of the things that we do with those dollars that Kim was talking about was work with the community of providers to come up with pilots in ways that transform how different healthcare is provided, and then work with those pilots to figure out how to continue to make that process sustainable moving forward as we shift the healthcare delivery system from a fee-for-service to a fee-for-quality and outcomes. It's a huge shift and a huge transformation, and so little steps along the way is what we're working on to change that, to approach things differently. And one is a big piece is integrating mental health or behavioral health with physical health, and that's just an example of one of the pieces that we're working on.